Hi, my name's Dr. Sridatta and I'm a consultant obstetrician and gynaecologist in London. I'm also an ambassador for the British Medical Association Research Foundation. Over the next few minutes, I'm going to talk about what happens when you've found out that you're pregnant. Firstly, congratulations. Over the next 9 months, your body will go through some amazing changes. It's really important, therefore, to start looking at your lifestyle, your diet, and taking care of yourself in a perhaps slightly different way to what you've been doing already. In addition to that, it's really important to make sure that you register for antenatal or pregnancy care as soon as you recognise that you're pregnant. But first things first, how do you actually work out your due date? Well, it really depends on whether you have a regular menstrual cycle, so whether your periods come every 28 days or 31 days. There are various different pregnancy due date calculators that are available on the internet through a straightforward internet search. But one of the classic ways of working out when your due date is simply to add 7 days to the first date of your last period and 9 months. It is that simple. But it's only effective if you have a regular 28-day menstrual cycle. The other key thing to recognise is that pregnancy generally lasts from 37 to 42 weeks. So, although you might get a due date that you've calculated through an internet calculator or using your last menstrual period date, it may not work out to be the exact date that your baby is born. And in fact, only 1 in 20 babies are born on their due date. So what do you actually do once you've found out you're pregnant? How do you access pregnancy care? Well, the first thing to do is to book an appointment with your GP. And once they have booked you for antenatal care, you'll receive an appointment with a midwife. Essentially, she goes through any medical problems you have, any medications you're taking, and asks you lifestyle questions such as, are you smoking? How much do you drink? So she can provide some valuable insights straight away in the early stages of your pregnancy as to what's beneficial. She'll also book you in for blood tests around about 10 to 12 weeks of pregnancy, along with an ultrasound scan. Now, this ultrasound scan is absolutely key and it should be timed as accurately as possible for between 11 to 14 weeks of pregnancy. It's really important because it can calculate your exact due date as accurately as possible. It looks at how many babies are growing in your womb, so whether you're expecting twins or one baby, and it also checks on the baby's heartbeat. It's also a really important check just to make sure that the baby is developing, although later on in pregnancy there's a more advanced scan at 20 weeks and you'll be booked in for that later on. So your midwife will also take a look at your diet, any medications that you've on, as we said earlier, but also whether you need to change anything in your lifestyle. If you're a smoker, for example, you may want to think about cutting down, and she can put you in touch with people who can support you in stopping smoking. She'll also consider the amount of alcohol that you're drinking and how hectic your lifestyle is. It's really important to consider your diet very carefully. And in terms of diet, it might be worth looking at the amount of protein that you're eating, or perhaps looking at the type of protein that you're eating, so live cheeses, for example. The blood tests that your midwife will order include looking at whether you're anemic, making sure your thyroid function is working correctly, and also that there's no underlying infection. You'll also find out your blood group at this point. One of the things that your midwife is also screening for is to find out whether you have any medical problems or have had any problems in your previous pregnancy. Now, this is really important because you may need to be referred to a specialist in pregnancy or an obstetrician. So this is something that she will discuss with you at your booking appointment. This means that you'll then be referred to a specialist antenatal clinic where you'll be reviewed by doctors to see what adjustment needs to be made in pregnancy or in fact at the time of delivery. So what can you actually expect in pregnancy? Well, the most common signs and symptoms include breast tenderness and vomiting, specifically morning sickness, and that's really not unusual in the early stages of pregnancy. Usually, this gets better by about week 12 up to about week 15, but for a small minority of women, they find that that sickness unfortunately does persist. There is medication that you can take for morning sickness, so please make sure that you go and see your doctor if you're not able to eat or in fact keep down water. Other things you might experience include bleeding, abnormal vaginal discharge, or in fact tummy pain. And if this is significant, then it's actually worthwhile getting checked over by your doctor. It is safe to take paracetamol in pregnancy, but only in small doses. So if the pain isn't settling despite paracetamol, it's probably time to go and see your doctor. So just to recap, today we've looked at what to do once you've found out you're pregnant. We've also looked at who to contact, what to expect, and how to calculate the all-important due date. My name's Dr. Sri Datta, and I hope this has been helpful for you.